Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 7 additional deaths due to COVID-19 have been reported today. We have a female in her 30s from Interlake Eastern Region, a female in her 70s from Winnipeg Region, a male in his 70s from Winnipeg Region linked to the Victoria General Hospital outbreak, a male in his 80s from Southern Health Santé Sud, another male in his 80s from Southern Health Santé Sud, a female in her 90s from the Winnipeg region linked to the Saul and Clarabelle Simpkin Centre, and a female in her 90s from the Winnipeg region also linked to the Saul and Clarabelle Simpkin Centre. I want to extend my condolences to their family and loved ones. The current 5-day COVID-19 test positivity rate is 13.6% provincially, 13.3% in the Winnipeg region. We have 270 new cases of the virus identified as of 9:30 a.m., one of which was identified to be from outside of province, so our new net cases are 269, taking our total number of confirmed cases to 11,608. Wanted to address some rumors about our lab process that we've seen on social media. There are rumors that lab tests are being declared positive without being processed, and certainly this is nonsense. This is not at all true. Our lab tests are processed through the PCR technology, and only those reported as positive are test positive. The links to messages from registered nurses in the lab, and again this points to that this is not accurate information, as we don't have nurses working directly in these labs. So again, remind Manitobans to follow credible advice. Go to our website, manitoba.ca/COVID-19. But I can assure you there is no truth in this rumor. For whatever reason, there are individuals who want to convince people that COVID is not a true threat. And as much as we'd all love to be able to put our heads in the sand and ignore what's going on, you can see from our hospitals, you can see from these deaths that I'm announcing every day that we just can't ignore COVID-19. So we can't listen to people trying to convince us that it's not a big issue. We all wish it wasn't an issue, but I assure you it is. We need to act now to decrease the amount of harm this virus is causing Manitoba right now. We continue to see these numbers. Certainly, we can't make a lot out of the numbers today. Early in weeks, we've often seen lower reported case numbers. So we need to maintain our vigilance. We know that our ICUs are at capacity. We've extended our ICU capacity, and we know there's ongoing strain throughout our healthcare system, so we can't sustain these numbers. I know that these numbers and these discussions are scary, but on the other side of that is we know exactly what to do, and most of us are already doing that. We'll start to see these numbers turn around if we stay vigilant. Our messaging has been quite clear: stay home, leaving only for essential reasons. Socialize only with members of your household. Along the same lines is Black Friday is coming up. This is historically a big shopping day, and we've seen a number of advertisements from stores here in Manitoba about big in-person sales on Black Friday. Talking about lining up to get in, talking about all the big sales. So I think I want to be really clear here with the numbers is that this is irresponsible. Right? We can't accept this. We're in code red in Winnipeg right now. We have people dying every day. We have our healthcare workers telling us that our hospitals are reaching their limits. This isn't the time for having a large in-person sale for non-essential goods or services. Okay? There's lots of things that can be curbside pickup online, right? But we can't have busy businesses for non-essential reasons right now. Our hospitals are at their limits. These stores will have to limit their capacity to 25%, those that are allowed to be open, those that are deemed to be critical. They must ensure that their patrons are keeping that 2-meter distance. We need all Manitobans, including businesses, to do their part. This is a critical juncture for us. They'll certainly be subject to enforcement and fines if our public health orders aren't followed. We may just reconsider what those categories of essential businesses are and the rules that govern them. It's very critical that we act now. Staying home, going out only for essential purposes, going out for a Black Friday sale for non-essential things isn't what qualifies for that. So please, let's all step up. Again, it's such a challenging time. We're missing out on so many things, missing out on the gatherings that we love, on milestones, even just that in-person contact that a lot of people are striving for right now. But we have to deal with this virus right now. We have to act right now, get these numbers down. We can get back to those things. We're going to get back to normal, but it's just not right now. So please stay home, go out only for those essential reasons. But we can act now, but we got to act together. We have to protect ourselves, protect the people around us, protect our healthcare workers, protect the most vulnerable people in our society. If we stay home, limit our contacts, socialize only with members of our household, we're going to start seeing these numbers come back around. So again, thanks to everyone who are doing their part, and I can open up for some questions.
Thank you, Doctor. A reminder to our reporters on the phone, you will have one preliminary question and one follow-up. From the Canadian Press, Steve.
Dr. Roussin, Steve Lambert from the Canadian Press. You've mentioned a couple of times that the government is considering further restrictions on the categories of businesses that can remain open. Can you shed some light on that? And is it by type of goods sold, by size of store, anything of that?
Yeah, and it's difficult right now. We don't have any of those details. Things that we are looking at are there critical items that are possible that we can possibly list? Are there better categories of critical businesses that can be open where we can narrow it better? So these are all the type of things we're looking at, including what we've discussed before about gatherings in households. Is there a way that we can clarify that and make that more strict as well? So these are all the things we're reviewing.
And the concept of having a longer school break at Christmas, can you shed some light on what is being considered there in terms of giving kids longer time off school at Christmas?
Yeah, and so these are just things that we're looking at. Of course, we base it on what we're seeing with our epidemiology, and like we saw that a lot of cases being identified in school-aged children, not a lot of transmission. So we're not really basing it on the risk of transmission that we're seeing, but we're looking at are there ways to to further decrease the chance. As we know, the increase in community transmission, then you're going to increase the risk of transmission really anywhere if it gets really high. So we're looking at that. What we're thinking about of the extending, and again, this is just things that multiple jurisdictions are looking at. No one's made any decisions on, but we know that over the holiday break, we're going to have, again, strong messaging that there can't be a lot of gathering. We know it's going to be challenging for people, and probably there will be gatherings that occur. And so giving possibly an extended time after that break may be able to give us an incubation period after a large amount of gathering and maybe offset some of that. So these are just the type of things that are on the table. No decision has been made.
From CTV News, Michelle.
Hi, Dr. Roussin. I am wondering, what do you think about people not getting tested? They might suspect that they have COVID-19, but they don't think it's worth going to get a test and they just stay home.
A couple of things. So one, like a big issue with that is stigma. So we really want to make sure we're not stigmatizing individuals who do acquire COVID because we don't want anyone deterred from going for COVID testing. It's ideal if you have symptoms to be tested as soon as possible because if we know that case, we can do the contact tracing. So again, that's really important to us. People who are symptomatic, who just won't go testing, we need you to stay at home for 10 days after the symptom onset because we can't have symptomatic people walking around who may have COVID. So that's the real issue there is people who aren't going to get tested, we need you to self-isolate for at least 10 days after the onset of the symptoms. But we'd really prefer everyone with symptoms to get tested because we can get the case, we can do the contact tracing.
Okay, my second question is about the flu. Usually we would have a couple of weeks of information about the flu season here in Manitoba. Nationally, they're saying it's very low. Do you have any information on if we have any confirmed cases of influenza?
Have any confirmed cases of influenza as of right now? In fact, all of our respiratory viruses trending very low right now. A few cases of RSV, few cases of rhinovirus, but normally around this time of year we'll start seeing increases in all those type of respiratory viruses. Influenza usually see a lot higher levels of RSV. So right now we're not.
From City News, Stephanie.
Hi, Dr. Roussin. With City News. Online, there's become a bit of a trend with some people storming into hospitals and taking videos of empty waiting rooms and trying to spread this online as COVID-19 isn't real. What do you say to those people and people watching those videos?
Yeah, and so this is along the same lines of this post about the lab. For whatever reason, there's a group of people who are desperately trying to convince the public that COVID doesn't exist. But you can see from our hospitals, you can see from these deaths, you can see from our ICUs, you can see from countless healthcare workers. COVID is here. COVID is causing a lot of harm right now. And so walking into an emergency waiting room and taking a picture for a few minutes of it being not crowded doesn't mean anything. Our hospitals are nearing their capacity. We have over 200 people in hospital right now with COVID. We have over 40 people in ICU with COVID. We have letters written from all sorts of healthcare workers telling us the demand. So somebody videotaping a quiet waiting room for a few minutes is meaningless. So we have to keep our focus. COVID is here. We'd all love for it not to be, but it is. And so we need to stay firm. We need to stay focused, and then we can start bringing down these numbers.
Yeah, and can you say if there will be additional restrictions put in place for kind of non-essential big box stores before Black Friday, or when we might be able to see about those?
These are the things we're looking at right now, how best to get this through. I think it's clear that what happened this last weekend, we can't have that happen again, where we have just busy stores, non-essential things being sold. We certainly can't have that. So if we're looking at ways, do we change the restrictions? Do we just work closer with these areas? So we haven't landed on anything yet. So hope to have something a bit more solid for you soon.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, do you think enforcement is making a difference in case numbers right now?
Well, I think it's too early to judge any of this on the case numbers. I think that the restrictions are absolutely necessary, and we're going to see compliance with these orders. We're going to see these cases start coming down, and it's ultimately for one thing, is that people are decreasing their amount of contacts. And so that takes many forms. That takes, staying home. It takes, when you do go out for essentials, having less capacity in those areas, people paying attention to the fundamentals, people staying home when they're ill. So there'll be a lot of steps to it. But ultimately, the common theme there is decreasing our number of contacts.
And on Wednesday, a lot of people had more social contacts than normal as they were saying goodbye to people for weeks or a month. Are you anticipating to see more cases as a result of this?
Not necessarily. I think that when we made that announcement, we make it clear that that we're only putting these restrictions in because it's very serious right now. It's not serious a couple days from there, but we want to give that notice mostly to businesses that have schedules and trying to work things out. So time will tell what we see. But we really hope that Manitobans are aware of just how critical things are right now.
Thank you.
From the Winnipeg Free Press, Timur.
Hi, Dr. Roussin. This is Timur Durrani from the Winnipeg Free Press. So independent restaurants and retailers are demanding answers about the exact science and rationale behind pandemic shutdowns, saying they feel like they're being scapegoated because it's easier to shut them down and restrict their business compared with big box stores that you said yourself are gathering far too many people. Are there any epidemiological reasons apart from limiting gatherings that have caused code red restrictions for businesses to be virtually the same as they were in spring? Do you not believe businesses have learned about COVID protocols during this time since PPE and social distancing have been introduced to them?
Yeah, so I mean, there's a lot of evidence here from outbreaks linked to bars, restaurants. There's even further that are linked to those sectors. If we look, around the country and around the world. So I mean, it's just we're not targeting anyone. We're targeting the virus, right? So the virus is spread with prolonged indoor contact. And if we talk about, well, everyone's doing the right thing, I would just point to our numbers, right? Like, look at our numbers. We're not all doing the right thing. So we're at a critical point right now where our ICUs are nearing capacity. So we need to do something. And so we look at all the evidence, and I certainly do feel bad that people feel that they're targeted, because we don't target anyone with this. We're targeting the virus. And so we know it's challenging. Relation to the big box stores and the crowd, that's absolutely right. We can't have that happen. But that's not evidence that we should open places where prolonged indoor contact occurs. So it's if you look at our numbers, any sort of suggestion that we already know what to do with the COVID is dispelled. We don't. Our numbers have climbed so dramatically.
But Dr. Roussin, when certain businesses are called essential and others are called non-essential during this time, you can understand how there is a little bit of confusion for businesses if, say right now I could go buy game consoles at a large store that has been dubbed essential, but a small retailer that is maybe selling clothing and would have socially distanced people, I can't do that anymore.
Yeah, and so that's what I mean is what's happened on the weekend and the example that you give, we have to find a way to address that. The way to address that is not just to let everyone open up though, right? We need to decrease the amount that people go out. So one is on the demand side. Our messaging is you shouldn't be going into a store to buy a game console. That's not essential right now. What's essential right now is people stay home. And so we are looking at a way to kind of clarify that, but that to me that's not a great argument saying that means we should just have everything open. But absolutely, we should look at ways to ensure the critical businesses are truly operating as critical businesses.
From Global, Marnie.
Good afternoon, Dr. Roussin. Are you able to provide a little bit more information on the death of the woman in her 30s from Interlake Eastern? Did she have any underlying conditions?
Yeah, so I don't have a lot details on that, and I mean all of the deaths we announce here are are tragic, right? That we see, but especially when we see a young person die of this virus, it really we all need to take that moment of pause. So there were some underlying conditions, but still it's really tragic when we look at all of these deaths that we're announcing every day here now, but especially when we see such a young person.
And just kind of adding on to that, I know before you spoke about kind of just the ranges in ages that we're seeing for people in hospital and ICU. Can you provide just an update on the age range of the people that are hospitalized due to COVID right now?
Yeah, so there is quite a range. So I mean, in hospital right now, there's approximately like around 30 people under the age of 50 that are in hospital right now. 9 of which I believe are in ICU. So there are young people that are seeing significant outcomes with this.
From the Brandon Sun, Michelle.
Yes, good afternoon, Dr. Roussin. My first question has to do with outdoor recreation spaces being closed again and equipment removed. Considering the risk was deemed low for outside activities and there are positive physical and mental benefits associated with recreation activities, especially, for example, school play structures, which are used during the day by school children, then closed outside school hours. So can you sort of outline a little bit of the rationale for that?
All of it is again the balance and trying to keep the message as clear as we can. And so the message is we should be staying home as much as we can. And so these being outdoors, doing things that are individual or with our family unit outdoors is great. Stay active, get that. Say getting to a hockey rink with 20 children outside, not that great. And so, so we need to have that balance. You're right, being outdoors, being active has a lot of benefits, and so I'd still encourage Manitobans to stay active. But mostly, that's got to take care within your family unit, right? We're not going to socialize with people outside of our household. Because right now we're just so critical. We don't have time for nuanced messaging. We have to just be staying home, socializing only with our household right now. We'll get back to all those things.
Okay, thank you. My second question is having to do with the rules related to hunting and harvesting. So it's deer hunting season right now, and people are going out. We did ask the health department, and the reply was hunting is permitted under the orders. That said, we urge Manitobans not to socialize with those outside their household. Now, that being said, which is fine, but do you have more detailed guidelines to offer, as hunting is often a small group activity with the aim of providing much-needed food in many cases, and often involves 2 or more people. And it's not necessarily a household activity. So can you be a little more specific with guidelines related to hunting and harvesting, please?
Yeah, and so for all these things, and this is why we talk about things like the fundamentals, it's because it's really hard to have guidelines for every possible eventuality, but the fundamentals apply to all of them. And so we have the rules, right? So the group size is 5 right now, so that's going to apply indoors or outdoors. What we're messaging is even better if that's all people from your household. If possible. And then you want to do whatever you can to keep that distancing, ensure no one there is ill, frequent hand hygiene. So there's a lot of things that we can do to make these activities safe, and and certainly the fundamentals apply and the group size orders apply as well.
From CJOB, Will.
Good afternoon, Dr. Roussin. Although we've heard about it happening elsewhere, I think some people may still be a little shocked to hear about the death of a person in their 30s. Could you just elaborate a little for us on the level of risk facing younger people? I'm thinking kind of in 20s and 30s, that sort of thing.
That's right. So I'd say that, from what we've seen is that age is, is typically the biggest risk factor for this. People over age 60 are quite at risk for severe outcomes. And then certainly underlying medical conditions and any things, especially respiratory, cardiac or immune systems, then people of any age can be at risk with it. And what we see is that when we're talking about risk, right, risk is a proportion, and so the risk here for younger people is certainly lower than people with underlying medical conditions or people with over age 60. But when you start seeing hundreds and hundreds of cases a day, then now that low risk starts showing up. Even though it's a low risk, we're getting hundreds of cases a day. So eventually we're going to see less common things occur. And so this virus, no one is immune from this virus. No one is immune from a severe outcome from this virus. Certain people are at more risk than it. And then no one's risk is truly their own. We can spread this virus unknowingly and certainly unintentionally. But the best thing we can do right now to protect ourselves and the people around us is to reduce the amount of contacts we have.
Okay, thank you very much for that. I know Mr. Gusa usually provides these details, but I'm wondering if you have with you our current ICU capacity, if we've added any new beds, and also the test positivity rate for the Southern Health region, if you have.
Yeah, so I don't have the ICU capacity overall. I know we have 41 patients in ICU. As far as the Southern test positivity, remember we don't share these commonly because the denominator's so low. There's a lot of variability in the rural regions, so we don't really like to share those because they're less valid than what we see, say, in the Winnipeg, where we have so many tests being done.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Scott Bill, Winnipeg Sun. I hate to drone on about this, but I got to go back to these restrictions. Why are people allowed to go to stores, allowed to gather in people of 5, when the messaging is counter to that? We have a public health orders that suggest one thing and strong messaging that suggests another thing. You have said that you can't, it's not easy to mirror both in it, but people will take if you give them an inch, they'll take a mile. We've seen that. That's why our numbers are what they are right now. So why not just mirror them? I know you say it's difficult, but at a time where these numbers are out of control, why not make it, whether it's difficult or not, do it anyway?
Yeah, so so I'd say that the messaging and the orders certainly aren't contrary to each other, right? Like we have strong messaging about staying at home, and alongside of that, we have our most strict gathering sizes we've ever had. So they're not exactly mirrored, but they're keeping along the same lines. Right? We've never been at group sizes 5 prior to this. And we've never had it even applied to private residences. So we are way more strict than we used to be, even with the orders. Although the messaging, yes, is even more strict. So I can tell you that it is something we're reviewing. We want to find a way to just remove any any such distraction with it, that we can provide an order that is enforceable, that we can actually enforce, and that still maintains a level of clarity that people can try to that people will be able to follow. So we are looking at that to bring them closer together. It is challenging. As far as why people can go to the store, again, it's we need to be able to have access to critical items. And then you find it challenging to narrow that when you have stores trying to essentially get around the orders. I think anyone can know in the spirit of the order what a critical business is. I think anyone can see that when our ICUs are almost full and we're trying to keep Manitobans at home, I think anyone can see what really is a critical business and what isn't. But apparently that hasn't been done. That hasn't been actioned. So we're going to have to find a way to ensure that is actioned. It is a bit challenging to come up with that level of detail to ensure the spirit is followed, but we are working on that and hope to have something really soon.
Thanks for that. And I guess I'm just kind of a follow-up to that, and I guess you sort of answered, but I'm just wondering how Manitobans can put faith in these orders, these guidelines, when they can, easily find quote unquote loopholes, or they can essentially just poke holes in. So how can people have faith in a plan that it to some might not seem effective?
Well, I think lots of laws and lots of regulations, have those type of things, and that's why creating regulations is difficult, and it often takes a long time to make these. A lot of engagement, a lot of looking at potential, unintended effects, a lot of reviewing. So we just don't have that time when we put these public health orders in. So it is a challenge that way. But you can find examples of many laws that have ways that people have found, to deny the spirit of them. So it's not unique to this. And so what I would say is that in a crisis like this, in a pandemic, there isn't going to be a restriction that's written down on paper that's going to get us out of this without buy-in from Manitobans. Right? We can't possibly be at every household counting the amount of people in there. We need the buy-in from Manitobans, and that's the most important thing. That's why we're here trying to message as much as we can how important this is. That's why we're here trying to dispel myths that we see in social media, because we really need that buy-in. And the public health orders are necessary, but they'll never be sufficient. We need the buy-in from Manitobans.
From CBC Radio Canada, Laisa.
Hi, Dr. Roussin. My first question will be about restrictions. I just want to know if the government is considering reimposing 14-day self-isolation rule for travelers from Western Canada, where we are also noticing spikes in cases and hospitalizations.
Oh, wait. Yeah. So as far as the self-isolation orders for travel outside of Manitoba, we're not changing that as of yet. We're not contemplating that. The epidemiology around us and here in Manitoba don't support really any change to our travel restrictions. So we haven't been looking at that. Certainly, we review these things all the time, but we don't have immediate plans on that. And then I didn't catch the last part of your question there. Sorry.
So I was asking if it's something that you are looking at now.
Yeah, not specifically, but these are always things that we're reviewing.
Question will be today. Premier said the province is selling charges against standby protectors. In addition to fine, are you able to bring clarification to this? What kind of charges and about how many?
No, I don't have any specifics on that. I think it's just, right now we need to be clear with Manitobans that we have to be able to step up right now. We don't have time anymore. Our ICUs don't have the space to allow us to deliberate on these restrictions. We all have to do our part, and it's got to start last week, but certainly needs to be now.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. Just following up on the 85 contacts you mentioned yesterday, where was that? What was the setting? Was it a faith gathering? Was it a northern isolated setting?
Yeah, it wasn't just from one setting. It was over a period of time, and so I don't really have any other details on that to share. But it wasn't just from one group of 85 people. It was multiple days of multiple contacts.
All right then. Earlier today, the Premier announced that no fewer than 90 G4S employees will help out with enforcement. Clearly, there's money available for that. Assuming there's money available for more contact tracers, I'm assuming you would have requested, given that we see cash available, how many contact tracers do we need, and what is your ask of this government?
Yeah, and so right now, when we're looking at our contact tracing capacity, it's we are nearing that ability to trace 700 cases in a day. So right now we're we're looking to even expand that further. Of course, looking at that, if we ever reach that level or higher, we'd certainly be in a real tough spot with our hospitals. But we just wanted to make sure we have excess capacity. So contact tracing right now, we did ask for a lot of support, and we've expanded it, with public health nursing, as well as with Canada Red Cross and the Stats Canada.
From the Globe and Mail, Shannon.
Good afternoon. My question actually is about going back to Steinbach for a moment and the rally that was held there over the weekend. I know it's only been 4 days since that rally, but I'm wondering if there should be any cases tied to that rally or any of these other conspiracy-related rallies we're seeing, if that would be publicly disclosed, that there are links between this rally and known cases.
Yeah, I think if we were confident that we had some cases like that, I do think that would be something I'd talk about, just to show, sort of the harms related to this. So, I don't know necessarily if we'll be able to have that information, right? We require people's history to tell us. But if we did know that, then I do think, barring any real big privacy reasons, that would be something we'd disclose.
Sure. And my second question is about the Southern Health Authority and Bethesda. Speaking to people there, it seems like there's a lot of concern growing about those working in the stretcher service. Are you aware of any cases, positive cases tied to people who are stretcher attendants in that service? Are those being counted in healthcare cases, or is that something that the province is not monitoring currently?
Yeah, you know what? I don't have details on that. I think we'll try to look at that and see if if Lynette can provide an update on that tomorrow.
From CBC National, Cameron.
Hi, good afternoon, Dr. Roussin. Just curious, given we have leading infection rate in the country and one of the worst right now in North America, are you getting questions from other jurisdictions asking what's happening, what you know about how the disease is spreading here, or in turn, are you being asked for advice from any other jurisdictions?
Well, I sit on the Special Advisory Committee of the Council of Chief Medical Officers of Health, so we meet twice a week, and we have throughout the pandemic. So we talk about interjurisdictional issues like this and our approaches. For instance, the schools and things. We're all that's where we discuss a lot of things like that. So. So not necessarily anything too specific. Definitely Public Health Agency of Canada, Dr. Tam, we're in close contact and checks in as well. So we have pretty good communication.
And just lastly, we're almost 3 weeks since the province went under orange restriction, almost a week since the critical red restriction. What are you personally hoping to see in the morning when you take a look at the numbers? What would give you a sense that things are starting to work or turn a tide? What are you looking for here?
Well, we're going to look at the trend, right? So we're going to start looking at a few of these trends. We're going to obviously the total case numbers per day are relevant because a certain proportion of them will be admitted to hospital and a smaller proportion will be admitted to ICU where we're already struggling. And then we want to see that test positivity rate coming down. And those are the sort of the early indicators that we'll be seeing. And then of course a sort of that week to 10 days after that, we're going to start seeing that translating into decreasing hospital admissions and ICU admissions. So the early indicators are going to be those case numbers, and even an earlier indication might be seeing the average amount of contacts per case. And so that could give us a real early sign of how this is panning out.
Thank you.
From the Winnipeg Sun, Josh.
Good afternoon, Dr. Roussin. I just want to follow up a little bit on what CBC Radio Canada asked about mentioning charges. Regardless of that specific situation, are there situations where, under the public health orders and legislation, where people can be charged beyond being fined for breaking public health orders as a means of enforcement?
Well, yeah, I mean, the Public Health Act makes it an offense to contravene any order. And so there are very strict penalties, which could include imprisonment, but they would require a prosecution.
Okay, and looking further at some of the situations that we're seeing, could we see an increase in some of the fines that are being handed out? I know a couple of weeks ago the province increased fines for individuals and businesses, but when we're talking about some of these big box stores, they're not keeping caps on their capacity. Could we see that increase from $5,000, or maybe organizers of rallies like what we saw in Steinbach? Could there be larger increase in fines for an individual in that kind of a case? Is that on the table? Is that something the province is looking at?
I'm not aware of any immediate plans in that direction. I think the fines are one thing. If there was an ongoing event or ongoing issue in a store that was putting Manitobans at risk, we do have the ability to issue an emergency health hazard order, which would close that facility or shut down the event if necessary. So we do have things at hand that if there was immediate risk, we have the ability under the Public Health Act, but I'm not aware of any further plans to increase the fines.
Thank you.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon, Dr. Roussin. I wanted to make sure I understood your comments on contact tracing correctly. So you said that you are nearing the ability to trace 700 cases in a day. So that means if we hit like 700 new cases in one day, we have that capacity. We almost have that capacity to perform contact tracing in a timely way within 24 hours of getting all those contacts. And so if you can just clarify that I'm understanding that correctly. And then I just wanted to make sure I understood. So who makes the decision, who has the final say about whether more contact tracing capacity is added?
So the capacity for contact tracing, like I say, is we're thinking that we're getting to a good spot on that. We have, probably over 200 public health nurses that we could assign to the case investigations. And on average, they're doing, between 3 and 4 cases per day. In addition to that, we have the people from Canada Red Cross and Stats Canada working on it. So we feel that we're in a pretty good spot. Now, again, up until now, the cases have been very much more complex than we saw in the first wave, where we saw mostly it was travel related or things like this. These are very complex cases, so they do still put a lot of strain on our public health tracers because they're so complex. But we do feel that we've dramatically increased our capacity. As far as the final say, it's really we have a system, right? So we right now we're working in incident command, and so through incident command, we would put any type of suggestions forward, and would ultimately get approved or not approved through that process. And then again with contact tracing, especially with the case investigation that public health nurses do, it's not only about having the authority to increase that. It's actually finding people to be able to do that who are already trained. So there's some complexity, but there isn't sort of just an easy answer to say who has final authority. It's we have a system that it goes through.
Thank you for that. I was wondering, so the province would previously announce, possible COVID exposures in retail settings. It just kind of seems like that effort has dropped off. Like, for instance, Sobeys, they reported 10 employees testing positive at its stores in Winnipeg in the past 2 weeks, but the province hasn't alerted the public of these possible exposures. I'm just wondering, why isn't public health announcing these exposures at grocery stores and essential retailers when likely they are happening with some frequency?
A lot of the issue with that is that a large proportion of our cases now we can't link to anything. And so, we could announce some of these type of things, but it's, the vast majority of them we're not finding where people are linked to. So the big messaging is to stay home, to be out in these places as little as possible, has a few of your family members out in these places as possible, and when you are out there, practicing the fundamentals.
Thank you, Doctor. We have time for a couple more questions. Please proceed.
Hey, Dr. Roussin, following up on Marnie's question about the woman in her 30s who died of COVID, how many people under 30 are in ICU, to your knowledge?
You know what? I don't. I took a look at the counts this morning, and I believe it's 9 people that are under 50. But I didn't tabulate, under on the other age groups though. So that's all I have right now.
Dr. Roussin, we have 34 new cases in Nunavut, 60 in total. Some are saying that those cases may have been acquired while those persons were in Winnipeg. What is your take on that?
I don't know that for sure, but I think that we have a very high test positivity rate in Winnipeg, so it certainly is possible, but I don't know any details of that.
Dr. Roussin, can you tell us what the average number of contacts per case this week is compared to last week?
Have an update on that, and so we're we'll be looking at it. And again, the average is sometimes tough because we have that range, so we have people self-isolating and we'll have, 0. And then we'll have, what we talked about yesterday, somebody over 80 contacts. So the average sometimes difficult. We'll look at maybe the median and try to follow that over time. But we definitely hope to see a trend down. That can also be misleading because even if we don't see a huge trend down, as long as those contacts are mostly household contacts, then again, we're going to see the amount of transmission declining over time.
Dr. Roussin, what does it mean when people get a canceled notice when they look online for the COVID-19 test?
That would that probably means there was an invalid sample for whatever reason, and so that could be one where there was a leaking sample. So this is what we just in practicing medicine generally we sometimes will get these results back, and it's either a faulty sample or is leaking. So we just usually will have to retest.
Dr. Roussin, do you have the overrate of people that may be, let's say, among like those that has a COVID-19 now, that's receiving a positive result? Do you have the overrate of those that are under 50?
Sorry, I didn't catch that fully.
Yeah, I'm asking among those that the cases that we have now in the province, do you have the overrate of people that are under 50?
Oh, under 50? No, I don't have that. Not of all the cases, not in front of me, anyways.
Danielle again from the Free Press. So on the subject of the public health exposure notices in retail settings, so we're hearing about members of the public going to the retail stores for likely non-essential purposes. Wouldn't informing the public about these potential exposures contribute to the buy-in that we need from people in staying home?
Well, we can, I don't know. I think that I don't see that as hurting if we can make these. We just don't want to give the, some sort of false sense of security that the places we're not reporting are somehow safe to go be crowded or to not practice fundamentals, right? So the messaging is just clear, is that you should only be going out for essential reasons. It should, only be one person, if possible, from your household doing that, and really for the shortest duration as possible. Just get those essentials and then be back home.
I have another question. This one is a little bit different. It's related to some of the languages that has changed regarding the aerosol transmission of COVID-19. I was wondering, how is public health adjusting how it directs places, jails, personal care homes, schools, and preventing and controlling outbreaks at facilities when the Public Health Agency of Canada is saying that there is aerosol transmission of COVID-19?
Yeah, and so again, this is not a huge change in it. We know that in transmission dynamics, we don't deal with things that are black and white, right? So we have these large droplet spread, and then along a continuum to small droplets to get aerosolized and suspended in the air. And so we know that it isn't black and white, and that's why we've spoke about ventilation. We speak about being outdoors. We speak about avoiding crowded indoor places. All right, that's all related to that possibility, the much lower possibility of some people aerosolizing things. So all that messaging is the same. By far, this virus is spread predominantly by large droplet, which means within that 2-meter distance, and then a greater proportion of that is with symptomatic people. So we know there's some asymptomatic spread. We know there's some suggestion that in certain periods of time there might be some aerosols, but for the most part, it's the large droplet spread. So all those fundamentals that we talk about.
Thank you, Doctor. This concludes today's media briefing.